So good morning, and I'm Paul Ford, and I'm with the Cleveland Center for Bioethics. I genuinely thank you for coming and want to say I look forward to the work we can do today. I reflected on this last night, and I thought, this event is going to be unsuccessful if all we have is good conversation and hear some good speakers. That's not my metric. If we come away with one new idea of how we can help people in different ways, new collaborations, or to bring the resources we're already using to bear in new ways around mental health, that will be a success. So even a small difference that we can make, it'll be successful. But this relies upon each of us. So we do have some time at the beginning to frame it, but through today, the expectation is each one will bring your experience and skills to help create those moments where we can really make a difference moving forward. I don't need to tell this audience that we have many needs surrounding mental health. This is the choir here. All of us, in fact, will probably experience some type of mental health crisis in our life if we haven't already. And certainly, we interact with family, friends, and others who do, and they need our support as community. They need the skills that are in this room, and they need to have accessibility to those. So, bring that lived experience, bring those skills, and we'll make a difference. We will exchange ways of doing things. An exchange is always a giving and a receiving. So this is an exchange. Each one of you is here because you have something to offer and you have something to take away. This isn't by happenstance any of you are sitting in this room. I also greatly appreciate your contribution to this. This is a contribution of your time and effort. Now, today's event is funded by a Cleveland Clinic philanthropy grant mechanism called Catalyst Grant. And I can't think of a better use of Catalyst than this. Bring together smart, well-meaning people, and good things are going to happen. We have over 200 people that signed up from 70 different organizations. It's a pretty broad coalition. There are more people that could be in this room to help, but this is a great beginning. We purposely held this meeting at a county-owned community college venue so that people would be comfortable. We're offering, after this summit, in 3 weeks and in 4 weeks, 2 more trainings for mental health first aid. The links were in the email from earlier this week, and I'll send another set. We already have 20% of those seats filled. It's going to be at Langston Hughes Community Center, an old Carnegie Library that they've been generous, the folks who run that facility, to provide a space. So I encourage you, if you don't know what mental health first aid is and you want some training, here's an opportunity to get the free training. It's a full day course. We will plan to reconvene some of the working groups in the spring to check in and see how we can move forward whatever idea you come up with. So this is not the end. This is yet another step. This program is co-hosted, though, by both the Cleveland Clinic Center for Bioethics as well as a community collaborative, faith and community together serving. Our 2 primary partners have been Bethany Baptist Church in that coalition, and thank you to Reverend Rowan, who is in the audience, and I greatly appreciate that. Oh, there you are. Appreciate the work of you and all of your colleagues at Bethany Baptist. You've been wonderful hosts, and thank you. One of the other primary collaborators is KHNEMU Foundation, which is Fred Ward, and he'll come up and say a few words. And they have mentored me and taught me a great deal as I've stepped out of my comfort zone from being in the hospital as a ethicist helping people at bedside to coming out and talking to the people doing work in our communities. And I am incredibly grateful to both of them for their patience and their teaching. I'd invite Fred to come up and say a few words of welcome from our co-hosts.
For some reason, I feel exceedingly comfortable. Well, greetings. Again, my name is Fred Ward. I'm the co-founder of the KHNEMU Foundation, which is a grassroots organization in the Glenville neighborhood, as well as co-founder of FACTS, which Dr. Paul talked about was faith and community together serving. Both of these sprung out of a need, being on the ground, of trying to garner as much support to fight the problems that we see on an everyday basis. So I'm honored to be amongst y'all today, each and every one of you. Our intention in putting together this summit was to have community perspective placed on the table, to listen, to learn, and evaluate the possibilities of trying some different practices toward healing our communities. And being from the inner city community, more often than not, there's a disconnect from larger systems and government structures. And I think there lies the problem. In the spirit of Black history, I will pose this question. Would an enslaved person want to be free and healed of their state and condition, or made comfortable while enduring it? And here's where we have an opportunity today to wrestle. Because many of us in the inner city, we believe that we can heal our communities, more so than just put a Band-Aid on it. We also believe that properly resourced, like the lead movement, like the pandemic in which we just come from up under, that a lot of the challenges that we face could be solved. We believe that, right? And in that belief, sometimes we struggle and wrestle with big systems that focus so much on infrastructure, brick and mortar. When we see every day people's lives being shattered, right, without having access to the resources and the knowledge and the other things that they need to be whole citizens. And so we must do more to address this. Today we have licensed professionals, community members, and we wanted to create this space so that you could have a healthy uncomfortableness in, like, what can we actually do and what can we do more of together? We're here to explore these possibilities together, right? And report out to those thought leaders that hold the purse strings, right? More often than not, we think about this work from a public safety or public health lens. And when me and Paul and we was out in, where was we at? We was in Portland, Oregon. And I left with some, because I was talking to some doctors, and they was talking about how when they're in the room with law enforcement and they having this narrative that they what they know don't matter, and that's a lie, right? Because the fact of their expertise, sometimes we know that, you know, hurt people, and that if you continue to do this, it will continue to not work. And so I encourage the licensed professionals, as we talk in these different groups amongst this summit, to share things that might not be traditional in the office setting, but share your knowledge about what work and what don't work. How can we change things that, you know, have systematically, historically not given us the results and outcome measures we want? Because the community needs you to stand up to that. You know, you'll see you'll see a lot of things that we have done as a small grassroots, very to limited funded organization, have made attempts, and there's others, to try to find a way to make these soft handoffs to the people that are licensed and know exactly what these actual signs and symptoms are. We went through all of that. We trained 147 people last year in mental health first aid, adult and juvenile, to try to prepare them for the soft handoff. This year, this summit is the second phase of how we come together collectively and attach and connect, right? And create a society and a city in which we want to not only live in, but leave behind. So get comfortable with the wrestle, share your ideas, hold nothing back, and let us find ways to report out to those that have the ability to make the decision to do something different. Thank you.
Thank you, Fred. That frames it beautifully, and we'll continue with a kind of framing in this panel. We have a tight schedule for today, and so I'll run you through it really quickly. We're officially ending the summit around 2:30 with an hour of networking to build, and then there are some after sessions that are optional that I think are going to be fantastic from 3:30 to 5. Next, right now we have a panel of 3 distinguished and accomplished people to reflect very briefly to help give a framework of both challenges and hope. That we followed by a summary of the Glenville pilot project around mental health first aid that Fred just talked about. We'll break into really the heart of this meeting is those working groups. And we'll do some work to come up with new ways of doing things. Yeah, so you can go to the next slide there. Working groups where we will have come up with at least one way that we can make a difference in a new way. We'll report back at working lunch, so you have some time to get your lunch, but you'll come back and we'll do work during lunch, and we'll do next steps. So we'll try to keep things rolling along, and all of these comments this morning are intended to be very short. So we want your feedback, and each of the people on the panel have questions that they're going to ask you to text the response to. So if you take out your phone and text OPE SURVE to number 2233, you text that, they'll come back, it'll come back that you've joined the OPE session. Office of Patient Experience is what that stands for. We've borrowed their account for this. And from that point, anytime that you text that number, that text will be a response and we'll see it up on the screen. Okay? So if you could go ahead and text, OPE survey to 22333. Anyone successful in doing that so far with getting them? Okay. Just wanted to check to make sure before we go to the next slide that it's actually working. So why don't we do a quick test to see how this works? So for instance, we came up with this question: how many miles do you drive to get here? Okay. So go ahead and text your response. And this is just a sample, and you can see that it starts to pop up. So this is a way that we're going to use to kind of crowdsource. So one of the speakers asks a question, and you type your response, and you'll be able to see in real time, as well as we'll save it to give the speakers, on something that they really want your feedback on. Right? And you can see that 21 right now is the winner for the furthest, but you can see that it'll scroll through. Anyone need any assistance with the polling? Okay, great. Good, 30. Okay, I'm going to move forward now to the very brief introductions. We have 3 people to come and for the next session, and really we talked about it as responding to people in crisis. Each of these individuals lives and works in an environment that encounters people who find themselves in crisis, various kinds of challenging situations. And I thought it would be great to hear from them their very brief 5-minute reflection about some aspect of that.